Hello and welcome to day 3 and the final edition of EULAR News. I'm Rudresh Shukla. I'm an NIHR Manchester BRC Clinical Research Fellow.
Hello, my name is Mert Öztaş. I'm a consultant rheumatologist in Istanbul.
Hello, my name is Serena Fasano. I am a Rheumatology Research Fellow working in Naples, Italy.
Hello, my name is Mrinalini. I'm an academic rheumatology trainee based in Liverpool in the UK.
And my name's Chris Wincup. I'm a consultant rheumatologist at King's College Hospital in London.
Okay, welcome back, guys. So, what did we get up to today, Serena?
Yeah, I was in a session, recent novelties in SLE and APS. Was a really interesting session. First of all, there was a discussion about management in lupus nephritis, in particular patients that are in remission. So there is a trial, the WIN lupus trial, investigating if it's possible to withdraw immunosuppressive treatment in lupus nephritis in remission, in particular azathioprine or mycophenolate. And the answer was unlikely no, because patients who withdraw treatment are more likely to have high rate of flares. And so I think that now the challenge remains identify which patient can withdraw treatment safely. And the second point was new drugs. So there was a trial about CAR T cells treatment. CAR T cells bind the surface B cell markers, in particular CD19, and kill B cells. And the question was, could be CAR T cells that is a really good treatment for B cell cancers could be used also for lupus nephritis, for lupus in general, for lupus patients. And the team by Professor Skett thinks so. So they investigated 4 lupus patients treated with B cell B CAR T cells, and they found that this patient go well. The treatment was well tolerated. They achieved remission or low disease activity, and there was a deep B cell depletion with normalization of C3 and C4 and clearance of anti-DNA antibodies. Chris, what do you think? You know that B cells play a key role in lupus pathogenesis, but there were many trials, especially about rituximab, that failed. So what do you think? This can be a new hope for lupus patients?
Yeah, I think it's really interesting, isn't it? I remember when the paper came out looking at CAR T cell therapy directed against anti-CD19 in patients with lupus. So I think it was one case of lupus. And it was a patient that had very, very refractory disease already. If I remember correctly, they'd had some cyclophosphamide. I think they may have also had rituximab. And so this treatment was really used as almost a last resort, I understand. Yeah. It's really interesting technology that allows for these therapeutics to be developed. And it's interesting you mentioned rituximab, which many of us are still quite happy to use in spite of the large trials showing no overall effect. But when we think about rituximab, we're thinking about a drug that was initially in the field of cancer, which we then brought into the rheumatology field. And with CAR T cell therapy, again, we're looking to our friends in oncology and seeing what therapeutics they use and applying that to lupus. Now, the treatment I've seen in malignancy, it can be quite challenging with lots of side effects. So I think the message was not, we use this in everyone as a new therapeutic, but if you have failed multiple options and have very active disease, then it's interesting to see this in the forum for discussion.
Completely agree. So you do you cover another session?
Yeah. So again, it's been a great day with lots of interesting abstracts presented on lupus. We had the oral abstract session on pathogenesis earlier, and there were some fantastic talks there covering a lot of great basic science. One of the talks that stood out to me was by Lucy Carter, who's at Leeds, and I had the opportunity to catch up with her and talk with her about all of her interesting work earlier on today. And we've got that interview just here. Hi, so I'm delighted to be joined here by Dr. Lucy Carter, who's just given a presentation in the lupus pathogenesis section. Thanks very much for coming and talking about your talk. It was fascinating. It was a real pleasure to be there. So can you tell me a little bit about how the project started and what kind of patients you were looking at?
Absolutely. So thanks for having me here. We have been studying individuals who are normally at risk for autoimmune connective tissue disease. That is to say that they are harbouring an ANA positivity without clinically manifest disease. So our observations previously have indicated that around 14% of those individuals, when followed up longitudinally, will progress to a definitive classifiable connective tissue disease over the first 12 months, and slightly smaller numbers progressing to a defined connective tissue disease thereafter. So therefore we consider that ANA positive state to be an at-risk state for lupus and autoimmune CTDs. But it's relatively difficult to predict which individuals will go on to manifest disease, although there are some clinical variables that can help you decide. We're interested in understanding the mechanisms that could drive or modulate that progression. So what we've done in this work is to isolate PBMCs from individuals who are at risk of autoimmune CTD, so they're positive for ANA. They've got some low-grade symptomatology that's of concern to their primary physician, but they don't meet any classification or convincing diagnostic criteria for a disease. We've isolated their PBMCs, and those have undergone bulk RNA sequencing. And the analysis I've just shown is based on WGCNA, so it's a modular analysis of gene expression. And this work has found 3 modules of interest which show correlation or either positive or negative with progression from ANA positivity to disease. The first one was predictive of progression, and that was interferon dominated, which supports some of our previous observations. We've got 2 more modules that appeared protective against progression, and we're still trying to unpick exactly what's happening amongst those genes. But it might be related to cellular metabolism, cell mobility, cell architecture, but some new targets to start investigating.
Great, so it's a really exciting project. You've already discovered lots and lots. Where are you thinking of taking this project next?
Well, we're actually fortunate that we've continued to recruit a second cohort of at-risk individuals, so it would be ideal to take this forward to validate certain targets. Selecting those is going to be the challenge because there's a huge wealth of data. Probably looking at defining some hub genes of interest, some pathway enrichments that are of interest, and selecting targets from those, and looking at in a second cohort. But those things are still in process.
Great, well, fantastic. Thank you once again for joining us today to share your fantastic data. And now back to you in the studio. So yeah, I thought that was a really, really great abstract. Lots of really interesting implications for patients with lupus, but also patients who are ANA positive that may then go on to develop and evolve into a connective tissue disease or something like lupus. So it really does make you think twice about seeing patients in clinic who are ANA positive that may not have any signs of underlying autoimmune disease, but immunologically there is something going on there. So really, what would you say were your highlights of today?
Yeah, so I'd like to highlight a couple of talks about breakthrough infections in people that have been vaccinated against COVID-19. The first one's looking at breakthrough infections and comparing in IMIDs and comparing them with controls. Just highlights that our traditional risk factors are still fairly important, rather than being immunocompromised or having rheumatic diseases unless you've been treated with anti-CD20 therapy. And the second talk that I wanted to highlight is from a German registry that compared people that were double vaccinated versus triple vaccinated. The ones that were triple vaccinated had more comorbidities and higher anti-CD20 use. But they had lesser time on invasive ventilation and less death rate. So really important data that's coming out from it. So Mert, were there any talks that you covered today?
Yeah, I have attended the MNUET session today, which mainly covers about the grant tips and tricks for the researchers who or planning to apply grants. So all the speakers gave really nice tricks for the young colleagues, and it was really great.
Yeah, I think it was a really good session that just highlighted key points that we
Yeah.
should take forward for all of our grant writing, right from short applications to anything higher level that we might be considering. What about you, Minnie? What did you look at today?
Yeah, so actually related to both of the things that you were talking about, so if I can just pick up from what Mert was saying, I went to a really good educational session as well today on how to differentiate between different arthritides. So the first talk was about enthesitis and how we can use that to differentiate between RA and other arthritides, and then the second talk in that session was looking at how we can differentiate between psoriatic arthritis and pain syndromes. And I know that particularly as a trainee, this is something which I do struggle with in the clinical practice, and so I'm always looking for ways in which I can improve my clinical practice and see how we can better differentiate between these diseases. And what I took away from it actually was the conclusions from the second talk, particularly were that clinical skills are so important, particularly when differentiating between an inflammatory arthritis and pain syndromes, but also the use of imaging such as ultrasound. And actually on reflection, it makes you realize like how much we might have struggled during the past couple of years when we've not had access to be able to examine our patients in person, which is ideally what we want to be doing. And speaking of which, the other session I went to was on COVID. Just coming back to what you were saying about vaccinations. So I actually went to a really good abstract session on COVID-19 infections in our immunosuppressed population. There was all really wonderful talks, including the outcomes from the Global Rheumatology Alliance, the latest results from there. So they were discussing COVID outcomes in people with psoriasis, which was a collaboration with SoProtect, which is the global psoriasis registry, as well as spondyloarthritis outcomes and also outcomes in myositis. Just to see sort of what the risk factors are in those populations, because of course people are still being infected, as you're saying, breakthrough infections, and also people who may not have received the ideal number of vaccination doses as yet. One thing also from that abstract session which really struck me was the outcomes in people who've got rheumatoid arthritis-related interstitial lung disease when they developed COVID, what the outcomes were there, and actually as you might expect, the COVID events, so mortality and admissions, were much higher in that population. But it just really made me wonder, is it the underlying lung pathology that's causing that? Is it the treatments? Is it a combination of both? And I think it's just an area where there's plenty more research to be done, particularly when we can see what the sort of lasting pathologies are after someone's also had COVID. So yeah, it was a really good inspirational session.
Yeah. So clearly COVID's still with us, but we've had so many great talks, presentations, educational sessions through EULAR, and this is obviously our final session for EULAR News. I just wanted to check what everyone's personal highlights were from the last 3 days. So I'll start with you, Mert.
Yeah, being an on-site was mainly great in EULAR, and I think that the distribution of the topics was also really balanced. So everyone can choose a topic, can choose their favorite topic, and learn lots of things from the tutors. And I really like the What's New sessions, which mainly covers the recent developments of the area. And secondly, I really like the Meet the Expert sessions, which also you can meet one of the most prominent experts about the area, and you can directly ask your questions with a small group of people. So it's an essential opportunity.
Yeah. Let me say thank you to EULAR to give me this opportunity to be here in person, especially after these difficult time, difficult 2 years. So it was great to attend the session, and in particular for me, interview the speakers and meet in person some people. So it was great. Thank you.
Obviously, my biggest highlight is doing EULAR TV. But aside from doing EULAR TV, I think picking up from what Mert and Serena have said, like being in person, I think particularly because, you know, even though research has maybe been hampered a little bit over the last 2 years, it has gone on, and a lot of, like all of us have, you know, done research with people we've never met before. And I think one really emotional thing for me coming here has been being able to meet the people who, you know, I've worked with, but I've never met. And that's been a real highlight and a real treat for me.
Great. I think, you know, I've obviously been sat here each night being biased towards the fact that I've been looking at lupus, but it is really exciting to hear about so many new drugs in development. And on that note, with EULAR TV, being able to speak to some of the experts, to get that advice in person, to bump into friends again in person is something to really appreciate. And the other exciting thing is that we've got some really interesting late-breaking abstracts. I've been able to speak with Professor Eric Moran today, who's given us some insight into a really interesting development that's going to be announced tomorrow. That interview will come out tomorrow, and we've still got some interviews that will be shown after this for people who have given us some really great insights. So in conclusion, great to see people in person, great to see everyone's enthusiasm, and great to have that inspiration to take back home and put into the next project.
So don't forget to tune in to some of the great interviews and scientific digests that we've collected over the last 3 days. They will continue to feature on EULAR TV. And saying that, I will bring this session of EULAR News to a close, and that's it for EULAR News 2022. And we've had a great time speaking to each other and speaking to everyone at the conference. Thank you to our viewers.